Welcome to the MamasteFit Podcast. On this episode, we have Dr. Sibyl Knight, who is a doctor of osteopathic medicine out in Monterey, California. She's going to be discussing what osteopathic medicine is, as well as what are the benefits of seeing someone when you're pregnant, as well as taking your kids there.
Welcome to the MamasteFit Podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit Podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you have chosen us to support you.
Welcome to the MamasteFit Podcast. On this episode, we have Dr. Sibyl Knight. She is a doctor of osteopathic medicine in Monterey, California, where I took my son and myself and my husband to be seen. Thank you for being here with us tonight.
My pleasure.
Can you introduce yourselves to our listeners?
I'm Dr. Sibyl Knight. I'm a doctor of osteopathic medicine here in Monterey and Santa Cruz, California, and I own a private practice here with my husband, where we mainly do osteopathic manipulation.
So doctors of osteopathic medicine are a little bit different than medical doctors that we typically see in the hospital. Can you explain the difference between doctors of osteopathic medicine?
Yeah, absolutely. So there's actually two fully licensed physicians in the United States. There's MDs, which pretty much everyone knows, and then there's DOs like me. And actually, most DOs do just practice medicine right alongside MDs. You've probably even seen DOs as your dermatologist or your family medicine doctor. But our schooling, our training is slightly different. So we do the same pathway in a lot of ways. We go to 4 years of undergrad, and then we go to 4 years of medical school, and then we do our residency training after medical school. However, during medical school, we have a course called osteopathic manipulation, and it's where we learn how to do essentially a type of body work on the body, because as osteopaths, we really believe that the structure of the body and the function of the body are very related. And so that's one of the main differences. The other main difference I would say is we're a little bit more holistically oriented. We like to see the people as a whole. A lot of more osteopaths will ask about your emotional state or other aspects of your lives, I think slightly more than MDs, but the more holistic MDs kind of line up with us too.
So what would be the difference between an osteopath and a chiropractor? I'm assuming the schooling is probably really different between the two.
Yeah, we get asked this question a lot, actually. So chiropractic school is its own pathway, totally. And honestly, I don't know that much about that pathway, except for that it's an advanced degree and it takes, 3 or 4 years. And people become doctors of chiropractic medicine, I guess. Are they medicine? They're DCs, whatever they are. And it's just, it's its own deal. The DOs is much more like a medicine, like a conventional medicine approach. So we do all of our training in the hospital. I've caught probably 20 babies in the course of my training. We work in the emergency room. We do surgery. We prescribe all the medications. We order all the labs. We order all the imaging. So it's just a slightly different approach. I feel like my chiropractor friends are maybe a little bit more primarily focused on musculoskeletal issues before the medicine part, whereas my training really made me think of a differential that includes all the terrible things that could happen also in addition to the musculoskeletal problems. So when I'm treating somebody, I'm going through a list in my mind of here's what it probably is, and here's the really awful things it could be that I need to look out for and rule out, I guess.
We had DOs at the hospital that I worked at that were doing their OBGYN residency program, but they also kind of did a little bit of osteopathic manipulations on some of the patients that would come into triage. And like people would be like, I would marry you. Whatever the heck, whatever magic you just did to me, like that was amazing. And that was like my first introduction to osteopathic medicine, which was kind of cool. But most of the DOs did not do that, aside from like a few of them that were like, yeah, like we learned this in school and it's this really cool technique. But like OBGYN doesn't really like utilize a lot of it because it's like the baby comes out. But I know that you see pregnant women at your clinic to do like manipulations with the pelvis. So can you tell like what are the benefits of doing that and what exactly you're doing?
Sure. Yeah. Yeah. Most DOs don't do osteopathic manipulation, which is really sad. Actually, what I find is that a lot of the doctors I meet who are DOs and I tell them what I do, they go, oh my God, I wish I would still do that. You know, like I wish I still was practicing that because I see patients all the time that could really benefit from it. And I just don't feel confident in my own skills to be able to do it. And then a lot of DOs are just treating their families. Like they'll be like, oh, I don't treat anyone, but I treat my wife, you know? Well, I mean, obviously, pregnant women are my favorite patients, honestly, because they're like the most grateful patients on the planet. They're so uncomfortable generally and in so much pain. And, you know, there's a lot of common kind of problems with pregnancy because we have all the relaxin and because people come into pregnancy with their own structural dysfunctions. And then you add the belly and you add the relaxin and you add the hormones and you add everything. It just is, you know, pregnancy can be uncomfortable, as those of us who have been through it understand. So what I do as an osteopath is, you know, I treat them just like I treat other patients, which is mainly my personal way of treating is to treat the fascia first. So I go in and I try to unwind the fascia and make sure that everything is, you know, as happy as possible. But also with pregnancy, I want to focus mainly on the pelvis, making sure the pelvis is straight, making sure the sacrum is mobile, so that when they do go into labor, that baby can descend and like get out of there easily. I'm going to prepare the tunnel, you know, for lack of a better term.
So like maintaining balance within the pelvis and making sure it can move so that the baby can shimmy through pretty much.
Yeah, and making sure the sacrum isn't like caught up on anything, right? Because the sacrum has such a huge role when the baby's descending, you know, it has to like nutate and counter-nutate. And if there's some kind of dysfunction that is causing like a sacroiliac joint to be not as mobile as it could be, then we're going to have issues when the baby starts to descend because the sacrum isn't going to be able to make that huge movement that it normally would. Does that make sense?
Yeah. Have you ever done like manipulations of someone who was in labor?
I have actually, but not as like a grown-up doctor. I went to a home birth of one of my colleagues, like one of my med student colleagues. His wife gave birth when we were in medical school, and I had treated her throughout her pregnancy, and then she had a stalled labor at home. And so I went and did treat her during that. That was a pretty interesting experience, actually. And she wound up giving birth at home, although it was like a pretty wild ride.
Yeah. Stalled labor at home. I can imagine. So did the manipulations kind of help her be able to progress?
It seemed like they did. I mean, it's always really what I do is so interesting because a lot of people don't feel like I'm doing that much. And sometimes even I, like during this particular situation, I'm like, I don't know if I affected it or if the baby just like came out, you know?
Just a coincidence.
I think it makes sense that treating a woman in labor, especially like the pelvic aspect, can be really helpful. I felt like I balanced her pelvis out a lot. It was moving better when I left her, but I don't know if that directly affected the birth or if it was just a nice relaxation moment for her, which I think is also important.
Yeah.
I don't know.
Yeah. I mean, well, I guess we'll never know, but I guess we'll never know. We'll hope that it was you.
It was me. It was all me. Just, like, mark
Take
myself.
full credit for. So Roxanne, you've seen both a chiropractor and an osteopath. Is that what we refer to it as, osteopath, or do I say osteopathic doctor? Like, so you've seen both. What is the difference for you as like the patient?
With chiropractic adjustments, they're like pushing a little bit harder. You feel like the crunching, or like you hear the crunching or popping. from the adjustments, and they're doing some fascial stuff during it. But the osteopathic manipulations that I had, like, it's very gentle, where like I feel the release, but it's not like it's because there's like a popping or like a very distinct moment. I mostly just felt, it's kind of like my nervous system felt reset afterwards, but I also felt more mobility in my pelvis afterwards, which was like, again, like you're saying, you don't feel like you're doing much, or like you as like on the table, like it doesn't feel like you're doing much until you like get up, really, that you're like, I feel of like $1,000,000. My husband, who had like tons of back pain, he got a lot of manipulations while we were in Monterey, and he's like, you don't think that it's like doing anything because it's so gentle, but like they find the exact like pressure point that you need them to press on. And he's like, it was like instant relief that I would feel. He's like, that was the only time I didn't have back pain, was when they were manipulating my back. And I was like, yeah, I could see it.
Yeah. So as osteopaths, there's a wide range of techniques that we learn. So we actually learn how to treat almost every tissue in the body. We learn how to treat, the fascia, the muscles, the alignment of the spine. Sometimes I find strain patterns actually within bones, like in interosseous strain patterns or intraosseous strain patterns. We treat the lymphatic system. We treat the nervous system. I mean, there's just like a really wide range of techniques that we learn and tissues that we pay attention to. And so every osteopath that you go to will be different. I'm a little bit more on like the gentle side because I kind of tend towards the fascial stuff and the cranial stuff. But you could go to like another osteopath and they could be more kind of like a chiropractor. We learn that same kind of high velocity, low amplitude thrusting. So I can whack and crack people, but I just like don't do it very often.
Yeah.
Occasionally on pregnant people, I actually do it. Just because it like feels so good to them to get that release, But what's funny is that I think as a society, we really think that we have to do something major to be out of pain, and I don't know, I guess that's just us, right? Like we want to push hard and we want to feel like you did something, but really, to feel better, your body probably isn't that far away from feeling better, that there can be really subtle things that you can do that can make you just feel so much more amazing. And that's kind of the realm that I work in is, the more subtle aspects. Like we just need to unwind your lumbodorsal fascia and then your whole pelvis resets and you can stand up straight and it's happy,
Yeah.
It all stacks against gravity again. But yeah, I get that comment a lot that like people lay on my table and they're like, well, I didn't really think that you did anything, but then my back felt amazing, the next day. So obviously there was something then.
Yeah.
Surprise.
Yeah.
I have that whenever I get massage, like with like deep tissue massage versus like cranial sacral massage, where like it doesn't feel like they're doing anything during it. And then like the next day I'm like, oh, I see. Like I feel a lot better in my body. Like things just feel like they've released and like reset. Okay, you don't have to give me all the pressure to have
I don't
relief.
need to like be cringing as you're like kneading into my muscle knots for it to be beneficial.
Yeah.
Do you feel like with like the osteopathic manipulations, it's like a little bit of intuition and like not for like to be like crunchy, but like you have to like feel like a certain thing where like some people might not be able to do these manipulations well because of like their like the feeling that they get. I can't think of the word, but it's
intuition.
Like, intuition is the only one I got.
Yeah. I mean, intuition definitely plays a role, and also just the neural pathways you make by like feeling someone over and over and over again. It's just I actually tell my patients this a lot. Like, how in some martial arts they cut like a board with their hand,
Yeah.
and they just hit it over and over again, and then the bone lays more bone down, and then it gets more and more, their hand gets like harder, It's kind of the same idea where when you do something, anything with your body, and you focus on one thing over and over and over again, your body is going to like create that reality for you. And so I think that's maybe not the best example, actually, now that I think about it.
No, I think it made sense.
You think it makes sense?
I think it made sense.
Good, I'll roll with it. Okay, so when you touch, I've touched like thousands and thousands of people now, right? And so the neural pathways are just really good. Like my fingers are really sensitive. I used to have a professor who used to tell me about his teacher, how when he gave a lecture about osteopathy, he would take someone's hair from the audience and he would put it underneath like 25 sheets of paper, and he could feel the hair through 25 sheets of paper, and he would like prove it to people, like, this is where the hair is, this is where the hair is. They would like move it around.
Gosh.
But it's just your fingers get really sensitive. So when your fingers are sensitive, you can feel things that other people can't feel. And that's one of the problems explaining our profession to people, because people are like, you just can't feel that. And I'm like, well, you can't feel that. So because your fingers don't know how to feel that, but my fingers can feel that.
That's amazing. I find that so amazing because it's like the pee under the mattress. Like the girl could feel the pee under her mattress. Like your fingers can just like feel all of the like minute details of the body to like identify abnormalities almost in a way.
Well, it's funny. Yeah. I mean, it's funny because you do feel abnormalities, but it's also like I feel where bodies want to go, if that makes sense.
Yeah.
Like that's most of what I do actually, is I feel into people's bodies and I go, okay, body, like where would you like to go? Because everyone's body is totally different. Some people really, mentally they want that whacking and cracking, but their body is like, no, absolutely not. I want to be like treated gently. I want to be taken this direction. And there's no real, once you get really into, I mean, of course we learn how to diagnose and treat what we call somatic dysfunction, the segments essentially that we're treating. So we go, okay, when we learn, we go, okay, so we go down the spine and T12 is rotated right and side bent left or whatever, and then we're going to treat that, right? But over time, the body really starts to unwind in ways that you just really don't anticipate, because people's fascia is complicated. And when you live a life like we live, if you use your body, or even if you're in, accidents, or you have these big, even birth trauma, people hang on to their birth trauma sometimes in their fascia, and that stuff just lives in the fascia. And so then when it gets an opportunity to get out of the fascia, it really does like these amazing things sometimes. I mean, I've had people go into shock on my table before because we kind of lined their fascia up with a car accident that they had been in, for example, and then they just are emotionally like taken back to that moment. It's wild to watch.
Oh man, that's probably like terrifying though. Like the first time it happens, all of a sudden someone's just in shock and you're like, what did I do?
Yeah, luckily I saw a professor do it one time before it happened to me. And so I watched that whole thing go down, but it was kind of shocking.
Yeah.
But now when it happens, I mean, it doesn't happen a lot or anything. It's not like I'm like,
every day,
like miracles all the time. But it is interesting. It's just really interesting that your body like holds on to that stuff,
Yeah.
And it makes you think about, it always makes me think about like birth trauma for both the mom and the baby, like what are we hanging on to from that stuff, especially like when it's really emotionally powerful and really tied to it.
Yeah. Do you have people that also have like a lot of emotions where they'll just start to like cry during release, like manipulations?
Yeah, sometimes. Yeah,
I can feel like that would be something that I would think would happen, because like we just hold on to like, usually it's like negative emotions or like sadness in all of our bodies, and when that comes out, it's a lot. Like I think somebody told me like when they went to the chiropractor the first time, they just like broke down because they just held on to something and they like hit it just right and they just started to cry, and they're like, oh my gosh, what did I do to you? Like, did I like hurt you? And they're like, no, I'm just feeling my feelings.
So I had that happen to me personally. One time I had my husband treat me and I had all this pain kind of in my thoracic spine, and he treated it. And it was like I was immediately transported back to my early 20s when my sister-in-law died. like emotionally, like that level of grief like came up flooding through me. And I was like, whoa, this, you just don't, when you grieve someone, the loss of someone, like, you go in cycles over time, but it's not like as strong as it is when you first hear about it. And this was like maybe like 10 years down the road. But I was like, I guess that was just in there, that was just in my body. And it was an area of my body that I had injured like shortly after she had died.
Oh, so you just like held on to it in there. Man, this could like definitely could be on like a crunchy level for people who might be listening. But I am a believer, obviously. Like, I think that this is amazing because the body is amazing. And like we hold on to things, like our nervous system and our emotions can like cause things to happen. I mean, like people can have heart attacks from like a broken heart. So like obviously our emotions and our nervous system have an effect on like our body as well. But like even kids, like you said, birth trauma, like from birth could potentially cause like things to develop in your babies. I mean, I don't think my son had a traumatic birth. Hopefully not. I mean, he did shoot through my pelvis like when I was pushing, but like I had a ton of issues with him where like he just didn't sleep. He always had like a runny nose and like kind of just felt like always sick. Never slept through the night. We had to get his adenoids taken out. And then like we brought him to you and you did like magic and he slept through the night for the first time and like was not mad when he woke up. Like I feel like every morning for the first like 18 months of his life, he just woke up and chose violence. Like just always upset that he was awake. Probably because he was tired, but like he never really slept. He nursed forever because he just like, that was the only thing that like comforted him, I feel like. But like he came and got manipulations and he was like a brand new child, like where he would sleep and like actually smiled more often. And so
that's awesome. That makes me so happy.
Yeah.
Yeah. I mean, so kids are my favorite aspect of society to treat. I mean, I treat people from like 0 to, I think my oldest patient so far has been like 102 or something.
Oh my gosh. Good for them.
Yeah, right. But kids are so much fun to treat, one, because they're so full, they're so vibrant and like full of health that they're really easy to treat, Like we kind of just like put them in the right spot and then their body's like, oh yeah, I'm going to go right there. There's no like fighting like there is in adult bodies, I guess. And they're not, they're really gummy. They don't have a lot, they're not like very solid bodies yet, right? They're mostly like connective tissue. So they're really easy to affect. And when it comes to like your son, I mean, a lot of times when you have, I mean, you didn't have like a particularly hard birth, but he might have been in your womb in a weird position, you never know.
Yeah.
And also like when babies come out, how their occiput is and all those, or their skull is and all those different pieces, right? And it's all overlapping. So when they come out and they take their first deep breath, the thought in osteopathy is kind of that sometimes those bones don't completely make it to exactly where they're supposed to. And then they can kind of have a little overlap or they can be like externally rotated or, there can just be like a little bit of dysfunction in there. And because it's the head, it really affects their nervous system because it's around their brain, right? And then brain itself has these lobes that have connective tissue in between them. So the actual connective tissue, like the dura inside the skull, is going in between the lobes of the brain and connecting inside the skull. So if there's some kind of strain pattern where it's like pulling in one direction, it can be affecting the brain, right? And that's the central nervous system. So of course, when kids get treated, their nervous systems totally relax because they might not have that like tension on that area anymore,
Yeah. I mean, definitely relaxed his nervous system. He was in probably fight or flight just for 18 months. And I have no idea why, but he definitely is not as much anymore, which I attribute to you, obviously.
That's great. I wish my daughter would be like that right now. She just wants to be angry all the time.
I know. Just let me adjust you.
I mean, I treat my kids constantly when they're like asleep. It's just that, yeah, she won't let me treat her.
Yeah. I mean, I feel like
like,
that's
no.
like with all kids, like their parents, like they won't trust anything you tell them until they're
Yeah,
like
no.
20.
My son loves to get treated. I mean, honestly, like being an osteopath is definitely my number one parenting hack, because if my kids won't go to sleep, I'll just like treat them and then they like relax and then they'll
Just
go
fall.
to sleep. You know?
Yeah. I need this hack.
Yeah.
So you only have to go to medical school,
Yeah.
go to
No big deal.
osteopathic school,
Spend
and then
like a few $100,000 and like 10 years of your life and you'll be good.
Yeah.
You're
And
all
I'll
set.
be able
Well,
to
my second
make my
parenting
kids go to
hack-
sleep.
My second parenting hack is to be near some grandparents.
Oh, yeah. We have that hack. Yeah.
parenting hack.
That is like just a life hack. Be near grandparents so that they can watch your children.
I know. I feel like I just did not understand that until I had kids, right? Like I lived in other places and I had my first son when I lived in Florida. My whole family lives here in California. And then I was like out there in Florida by myself, like, oh, and now it all comes together why people stay near their family, you know?
Let's take a break from this episode to learn about our sponsor, Needed, which is a nutrition company that's focused on the perinatal timeframe. We really love Needed's products. All of them we've taken during our pregnancies and our postpartums, and Gina is even taking a lot of their products during her trying to conceive.
So for those of you that are in the dark, I am trying to have another baby. I convinced my husband to procreate an additional time with me. We're going to have baby number 4. And so I am also 35, which means I'm ancient, and I will be a geriatric pregnancy when we conceive. And so I'm doing a lot of things now to really focus on optimizing my nutrition and optimizing my egg quality before we start to conceive. And so I'm taking Needed's egg quality support. They have a whole bundle where it comes with CoQ10 as well, which is really helpful for egg quality. And I'm also taking their stress support in addition to their prenatal vitamins and their collagen, just to kind of have this well-rounded supplementation to help support my nutrition to ensure that I have really good quality eggs. I have a history of miscarriage, and so I'm just trying to do everything that I can now to set myself up the best that I can for any future pregnancies. We've been with Needed since the beginning. We really trust their products, and I'm trusting them now in my trying to conceive phase. And my husband is also taking their products as well to support his sperm health and all of the other things. So it takes 2 to tango. I did have to convince him to make another baby with me. He was not hard to convince, though. He was easily. He probably wanted 4 and he just didn't want to admit it at first. But Needed is who we are trusting to support us in our trying to conceive phase. And if you're interested in trying them out, you can use code MamastePod to get 20% off your first order or a 3-month subscription. So if somebody is looking for an osteopathic doctor, how would they find one? Is there like a directory?
There are a couple of directories. So one would be through the American Academy of Osteopathy. Called the AAO, and you could just go to their website, americanacademyofosteopathy.com, and then they have a find a physician. So those are mainly physicians who do manipulation. And then there's the Osteopathic Cranial Academy, and they also have a directory, and those are people who are like kind of specifically trained in cranial work, which is really what like babies usually end up needing. One of the main things I actually do in my practice is I do breastfeeding medicine. I treat a lot of babies and deal with like latch issues, kind of specifically people who are having trouble like latching their baby, producing enough milk, that kind of stuff.
Oh, so what exactly do you do with that?
Yeah, I mean, because I'm an osteopath, I'm like a little bit more anatomically oriented, I think, than most breastfeeding medicine doctors are. But I often treat things like torticollis, like really a lot of tightness in the neck, or plagiocephaly. I work on any kind of dysfunctions that I think are affecting the baby's latches. I evaluate and treat tongue ties. Like I do snip tongue ties in the office occasionally. And yeah, that's like one of my little like passions, I guess, my side passions.
I had no idea you did that. I should have brought Colin to you when he got his tongue tie revised.
Yeah, it's something that I learned how to do. I don't know in timing wise, like whether or not I really was doing it that much back then or not. I was referring people for tongue tie, like frenotomies, but then I realized like how easy they are to do. And I just took a couple courses and was like, okay, well, I can totally do this. It's like the easiest procedure of my life.
Compared to a lot of the other things that you're doing. So you're manipulating baby and like assessing baby, but are you doing anything with the mom as well?
I don't usually need to do that much with the mom. I mean, I usually treat the mom because, every breastfeeding mother has like pain in their thoracic spine from bringing their breast down to their baby. Because we're all, we all do that. It's just so much easier than bringing the baby up to the nipple, Occasionally I have treated people's breasts, like especially if they're getting mastitis or like clogged ducts a lot. But I really just mainly I kind of do like a lactation consultant would. Like I have them breastfeed in the office. I like help them with the latch. I like grab onto their boob and stick the baby on the nipple, that kind of thing. And then I evaluate the baby while they're eating and go, oh, okay, I can see like what's happening here in terms of problems.
Yeah, I could totally. I mean, because I think you manipulated Colin while I was nursing one time.
Yeah.
It's they're always relaxed when they're feeding.
They're so happy. Yeah, they're so happy with the boob in their mouth. That's like their favorite place. Yeah.
I can see that being beneficial.
Is this something common for like osteopaths to do, or is this just like unique to your practice?
It's fairly unique. I mean, there are other osteopaths who are doing it. And interestingly enough, like in my breastfeeding medicine community, there's actually quite a few MDs who have started to take osteopathic manipulation courses to learn how to adjust babies. Yeah. Which I think is really cool. Actually.
That is really cool.
So it's kind of gaining a little bit of traction, but it's definitely like a little tiny pocket of us, And I just don't know that most osteopaths who do osteopathic manipulation will treat babies, but I think just those of us who have breastfed are really into breastfeeding.
Yeah.
I think that's how most people get into the perinatal time frame is they
had a baby,
got pregnant and had a baby, and they're like, we need more support for this community.
Yeah.
I mean, that's how I got into prenatal fitness, postpartum fitness, and birth dueling was I had a baby and was like, we need more resources.
Yeah. I mean, there's just not enough resources out there. And I hope that this is just like in 30 years, like when our kids are having kids, like this is the norm. Like you can like normally find someone like very easily to like do osteopathic manipulations to help you with breastfeeding, to like help your baby like who has like nervous system dysregulation and all that stuff. So hopefully one day.
Yeah. I mean, the tongue tie people have definitely started to make like inroads into kind of the conventional medicine space. Like you have the Breathe Institute now, and everyone's understanding that their airway needs to be open, and they're getting their tongue ties released, and they're taping their mouth shut. And I don't know, maybe that's not as common knowledge as I think it is, but it's definitely like more popular.
But it's also like who you surround yourself with. Like we think that like home birth center birth, like unmedicated labor, normal physiologic labor, like everybody wants this, but not everybody wants that.
Most people don't.
It's just who we surround ourselves with. Like this is the community that we're always like hearing. And so we're like, this is everyone. No, that's not everyone.
Yeah. No, it's actually only like 1% or 2% of people or something. like tiny amount in the United States.
Yeah.
Yeah, when I had a baby when I was in residency, and I had a home birth, and oh my God, you would have thought that I was like the craziest person on the planet with all my colleagues. They were just like, I cannot believe you're going to do this. And I'm like, hey, I'm in Florida. There's like a 45% C-section rate or something in my area for first-time mothers. Like, I think I'm going to risk it at home.
Yeah, risk benefit.
Yeah, but I guess I've always been like the crunchy doctor.
And that's okay. But thank you so much, Sybil, for coming on the podcast. This was so cool to learn a little bit more about osteopathic medicine, as well as like just like blow my mind with everything that you do in your practice. Where can our listeners find more about you?
Yeah, they can go to my Instagram for my practice, The Osteopathic Way. You can go to my Instagram, like my personal Instagram that I'm like never on anymore, Dr. Sibyl Knight. Or you can go to my website, theosteopathicway.com, and learn a little bit more about the breastfeeding.
Yeah. And if anyone's in the Santa Cruz or Monterey area, check them out. The Osteopathic Way, highly recommend. If you're military, they do take TRICARE. So
That's right.
Get a referral. I think that not many people know that.
Yes.
Like a lot of our friends who were looking for osteopathic doctors, they're like, what do you mean? I was like, go to them. TRICARE.
Yeah, no, we love our TRICARE patients. They're so grateful. You know,
Military medicine is great.
Yeah, military medicine is awesome. And everyone gets all their needs met in that system. TRICARE Prime people can get their referrals. And then if they have TRICARE Select, they can just come and see us.
Which is what I did. So check it out. But thank you again so much for coming on the podcast.
Thank you.
This was
Thanks
so great.
Much. I can't believe it's over. I have so many more things to say.
And we'll link everything that you shared below in the show notes.
Sweet.
Thank you for listening to this episode. If you enjoyed this episode, be sure to like and subscribe to our channel so you get notified whenever we release new episodes. We release new episodes every Wednesday and new birth stories every Friday. If you're pregnant and you're looking for more support throughout your pregnancies, you can join our online childbirth education course and our online prenatal fitness programs to help support you throughout your pregnancy with movement and with education so that you can approach your birth with confidence. If you're postpartum and you're looking for more support after birth, you can join our postpartum education course, which includes our postpartum prep, newborn care, infant massage, and infant CPR and choking, in addition to our postpartum fitness programs to help you get back to the gym and get back to the sports that you love. If you're a professional and you're wanting to learn from our expertise, you can join our birth worker course or our fitness trainer course so you can better support the perinatal population. This podcast is sponsored by Needed, which is a nutritional company that's focused on the perinatal timeframe. Roxanne and I have both used Needed throughout our pregnancies, our postpartum periods, and our husbands are also using Needed supplements to support their own health, and for me, our conception phase as well. So we love Needed, we trust their products, and we hope that you'll be interested in trying them out too. And you can use code MamastePod to get 20% off your first order or 3 months of subscription.